A common place for hamstring pain is proximal hamstring. So that's where that hamstring attaches up to the pelvis. So the ischial tuberosity are your sit bones. So best way to work on this, well, a way to work on this, wouldn't necessarily say the best. There's lots of different ways to work on it, but I'm going to show you with a lacrosse ball here. You want to be sitting on something firm enough. If you're on your bed at home, this is just going to sink right into that cushion. You're not going to get any effect from it. So I'm just going to show you on a chair here. They probably too soft of a chair anyways for this purpose, but I'm going to show you anyways on this. So you're going to take this ball and you're going to find kind of that ischial tuberosity. You could even sit on your hand and maybe move around until you can kind of feel that bump on your pelvis where you're sitting. That's where this ball is going to go. So you'll sit up, find that spot. In this case, for me, okay, about right there. I'm going to sit on it. And then we're going to do two things. One is we're just going to find, you can kind of adjust your hips until you find kind of that tender area. You're going to hold pressure on it. Okay, you're going to hold pressure. You can hold it for 30 seconds. Move around. Take a little pressure off. Do it again. Okay, it should start to feel a little bit less sore as you work on it. Okay. In the moment, with the pressure on it, it may hurt. Just because you're working out that tissue. Okay, the next thing we're going to do, find that spot again, put some pressure on. Actually going to move, so straighten that knee back and forth. Okay, all that's doing is shortening and lengthening that hamstring while that lacrosse ball has pressure on the attachment point or the origin of the muscle. So again, 20-30 repetitions, pause, move around, reassess. You can do that multiple times. That's a self-mobilization technique for the proximal hamstring.